Good, happy Monday morning, January 4th, 2021. I'm Riley King, and welcome to the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Monday morning, so let's begin. First up, we begin with COVID-19 updates. Health officials, 1,317 new cases of COVID-19 for the past 5 days and 11 deaths. Let's take a listen to that video from WMUR News 9.
Now offers easy online ordering for local home heating oil deliveries here in New Hampshire.
Deaths from COVID-19 across the country have reached a new milestone this weekend. More than 350,000 Americans have now died from this virus. Good evening. Thanks for joining us. I'm Charisse LeClaire. It comes just days after the country surpassed 20 million confirmed cases of COVID-19. New numbers just out on COVID-19 in New Hampshire show there are 11 new deaths to report today. That brings the number of deaths for the first 3 days of January up to 21 people. In total, 780 people in New Hampshire have now died from the virus. The total number of cases is now over 46,000. More than 1,300 new positive tests were reported today. They cover several days, dating back to December 29th. There are just over 6,000 current cases of COVID-19.
Okay, and there you go on that video and that report. New Hampshire COVID-19 updates, new information, data, maps, and graphs. Let's take a look at that information right now. And here is a look at that information for all of you right now. There are 46,450 number of people in New Hampshire have tested positive for COVID-19. 20,577,177 number of people in the United States have tested positive. 780 number of deaths from COVID-19 in New Hampshire. 913 number of people have been hospitalized with COVID-19 in New Hampshire. And 302 number of deaths from COVID-19 in the United States. Now let's take a look at this map of New Hampshire where current cases of COVID-19 are. In Concord, 302 current cases of COVID-19. Let's take a look at this map of New Hampshire where total cases of COVID-19 are. Concord, 1,763 total cases of COVID-19. Let's take a look at these three charts here. Let's start with the first chart here. New cases each day in New Hampshire in the purple, daily new positive COVID-19 cases, orange, new hospitalization, and red, deaths. Let's take a look at this chart here. Current cases in the purple, total current COVID-19 cases, orange, current hospitalization. Let's take a look at this chart here. Total cases in the purple, total positive COVID-19 cases, orange, total hospitalization, red, deaths, and blue, recovered. Let's take a look at this chart here. Positive PCR test rate, positive PCR and antigen test rate, and daily PCR test. Let's take a look at this chart here. Age group of cases and female and male of cases. Let's take a look at this chart here. Infections, hospitalizations, and deaths. Let's take a look at this chart here. Deaths, percent of New Hampshire population, race/ethnicity of cases, and hospitalizations. And a reminder, common symptoms: fever, lack of smell, cough, chills, difficult breathing, nausea, vomiting, and diarrhea. Participants and prevention tips. And be sure to stay with the Riley King Network for the latest of your COVID-19 information. New Hampshire COVID-19 hospitalization rates hit all-time high. Some hospitals cut back on elective procedures. Let's take a listen to that video from WMUR News 9, Tim Callery.
Break free from 2020 and get moving at Planet Fitness in our clean and spacious clubs. And use our crowd meter for the best time to visit. Join now for no enrollment, $10 a month, no commitment. Deal ends January 7th.
Back on December 1st, 160 people were hospitalized with COVID-19 in New Hampshire. Today, that number sits at 325, down slightly from yesterday's all-time high of 335.
Every hospital in the state is having more COVID patients in their hospitals than we were during the first surge back in the spring.
Dr. Michael Gilbert, Chief Medical Officer at Catholic Medical Center, says the reason for that is significant community spread of the virus.
There's more indoor activities, there's more holiday travel, and I think that the folks in the state are getting some COVID fatigue.
About 200 of the current hospitalizations are located south of Concord.
Clearly, the people who are more likely to be in the ICU have comorbid conditions, are older, but we're seeing quite a range of people, anywhere from your mid-30s up through 90.
Dr. Greg Baxter, president of Elliott Health System, says his hospital is making adjustments to keep up with the increase. For the next week, it will cut back on elective surgeries.
We're trying to accommodate our patients and physicians and helping patients get the care they need, but always making sure we have enough resources for the pandemic-related activity.
Catholic Medical Center may also make similar changes.
The biggest issue now is that because of all of the significant community spread, all of the hospitals actually in the nation are having some staffing shortages. And because of that, that's our challenge with taking care of patients.
And now the 26 acute care hospitals here in New Hampshire meet just about daily online to discuss the COVID-19 cases they're seeing, hospitalization rates, and any resources they could share to help ease this burden that they're experiencing during the pandemic. Reporting live tonight, I'm Tim Callery, WMUR News 9.
Okay, and there you go on that video and that report. New Congress sworn in ahead of big week in politics. New Hampshire delegation seeks bipartisan efforts. Let's take a listen to that video from WMUR News 9, Jessica Moran.
Irving Energy now offers easy online ordering for local home heating oil deliveries here in New Hampshire. Order it.
So I hope you got.
I do.
Congratulations, Senator.
A pandemic-appropriate swearing-in today with elbow bumps and masks for leaders on Capitol Hill, including New Hampshire's delegation, as the balance of power in the Senate still hangs in limbo. Georgia Senators Kelly Loeffler and David Perdue fighting to hold on to their seats in the midst of challenges by Democrats Raphael Warnock and John Ossoff.
Whoever wins, the goal should not be partisan advantage. The goal should be, what do we need to do to address what's happening in America?
And our lawmakers say a massive part of that is trying to get the COVID-19 pandemic under control.
I'm focused primarily on the distribution of vaccines to every corner of our state and our country. I'm going to be working with the Biden administration on the manufacturing of vaccines so that we get everyone vaccinated quickly.
And a bipartisan effort to get that done, they say, is key.
Things are going to be challenging for these next few months, no doubt, and we really need a whole-of-government response, regardless of party affiliation, to address this virus and make sure that people have what they need through a really tough time.
All of them objecting to a Republican-led effort expected this week to challenge the election results during Wednesday's Electoral College vote to verify Joe Biden's presidential win.
I think they're taking it too far in the sense that it really is threatening our democracy to try to convince half the American people that the election wasn't fair.
And Congresswoman Annie Kuster congratulating Speaker Nancy Pelosi on her re-election to the post, saying in part, quote, "I look forward to working with Speaker Pelosi and the Biden-Harris administration to build back better, defeat COVID-19, expand access to health care and opportunity for all Granite Staters, and tackle climate change to protect our future generations."
Okay, and there you go on that video and that report. Manchester aldermen to hear pitch for new homelessness services director. Manchester aldermen are set to hear a pitch from Mayor Joyce Craig this week for a new director's position to oversee and coordinate homelessness initiatives in the Queen City. And that does it for this morning edition of the Riley King Newscast, right here on the Riley King Network. Thank you for watching. Have a great rest of your day, and I'll see you back here later on today for another newscast. I'll have a news report coming up in a little bit. Goodbye, everyone.